This October, Aultman joins the American Physical Therapy Association in celebrating 50 years of the physical therapist assistant profession. Between 1940 and 1960, physical therapy experienced a boom in demand, and to respond to that, 80% of physical therapists used on-the-job trained aids in order to help them deliver care to their patients. Recognizing that that would be an issue with many pitfalls, the American Physical Therapy Association commissioned a group to develop a physical therapy assistant profession and program. In 1969, the first physical therapist assistants graduated from programs in Florida and Minnesota. And today, the Aultman Therapy Services Collaborative is blessed to have over 63 FTEs of physical therapist assistants that have provided over 1,400 years of service to our community. Recently, we spoke to some of our physical therapists across our health system about the role physical therapist assistants play in the care of our patients.
PTAs in our profession really are the heart and soul of what we do. They're the ones that see all of our patients on a regular basis. They're the ones that actually create that rapport, help the patients to feel confident and trust kind of what we're doing. In home care especially, they're the ones that are going out to see the patients, like I say, every day, but they're also interacting not only with the patient but with the family members. They have to kind of take care of the patient's kind of self-care, as well as sometimes emotional things that are going on in the home as well. They have to be able to do all those different things, juggle all those different things at one time, and our PTAs do an awesome job with that. They go above and beyond in providing our patients with equipment that they need, as well as sometimes they even go out of their pocket paying for food and different things that the patient might need, just to make sure that the patient has all the things that they need.
Well, I work at Aultman ORRVILLE Hospital, and we only have one physical therapy assistant. And the thing that impresses me the most is her adaptability. Not only does Amy have to fill in for our secretary when she's on vacation, but she also treats inpatients and outpatients and transition patients. We have 4 different physical therapists, and she has to match her treatment style to each one of those different therapists so that her patients have a seamless transition from the primary therapist to her care each time.
I think our PTAs mean a lot to our patients. They perform most all of our daily treatments with the patients. They form a close relationship by doing that. I've watched them have a difficult conversation with the patients. I've watched them push patients to help them reach their goals, as well as celebrate with them once they've reached that milestone. I've watched them joke to get a patient through a difficult treatment, as well as push them to achieve the goals that they want. Patients look at our PTAs as a friend and as a trusted professional.
When I think of the PTA profession, I think of some stories of the patients. I think of a young girl that we took care of for several months here at the hospital that had a brain injury, and just the tireless work that staff put in, thinking of creative ways to treat her. And they actually just found out today that she's going to go to physician's assistant school. And what really sticks out is a story of a patient with a dying wish to see her son go out on senior night on the field, and one of our PTAs taking their personal time and making that happen for her. So I just think of really just the compassion, and you see it in the care that they give to the patients.
In 23 years of experience, I have met great PTAs, and not only pushed me both in my PT skills, but also my compassion. Seeing a PTA take that extra time, have empathy towards our patients, really makes me be introspective about how I am treating my patients. It's amazing to see our PTAs not only work with the patients, but also the extra steps that they take. Been so lucky over these years to have it, to work with the Aultman PTs, PTAs, and also the Alliance ones, and just makes me just so proud to be part of the group.
I work with one PTA a lot and several occasionally, and none of them are afraid to really think and question and come up with things that we may not come up with or think of when we establish a plan of care. Sometimes you'll go in and the patients will say, no, there are no steps, because they don't really want to do steps. But the PTAs have a way of finding out the things that we don't find out on the evaluation. And there's many times that I have to revise a plan of care or revise goals, and my PTA is really good about timely coming back to me and saying, hey, could we look at this? This needs to change. I found this out and it's not the way we thought it was. So I just think really altering what I do based on what they find out during care.
The physical therapy assistants truly are the lifeline of Aultman Woodlawn, and they truly help out as therapists in every way possible. We therapists are the ones that initially set the plan of care and evaluate the patient, but these assistants are the ones that day after day work with these patients. They build a good rapport with the patients, They encourage them every little step along the way. They give them the confidence that they need to keep moving in the right direction. They make me and the other physical therapists look amazing. They give us ideas, they give us plans, they help us kind of guide the family and the patient in the right direction, and they truly are the lifeline. They're what makes us work so efficiently at Woodlawn and get the patient on the right track and home or to the safest level of care possible. They come in and day out and they give 100%, and I truly, truly appreciate what they do every day for us at Woodlawn, not just as a physical therapy department, but as Woodlawn as an entity. They really bring a lot to the table, and I appreciate all of their hard work every day.